For a technology-driven company like ours, it is critical that we work with partners to build out the technology, and the response thus far from potential partners has been extremely positive, and that gives us a lot of confidence that we're onto something and we're building a technology that fulfills an unmet need. So when I go meet partners, I look for their level of expertise in this domain. So all of the partnership discussions we're having are with top companies that are pioneering the space of regenerative medicine, specifically stem cell derived therapies, whether it's pharma or biotech. And the goal there is because most of these companies are developing therapies in their R&D facilities and then scaling it all the way up through production and delivering them to patients. Now with Cellino's business model, we're thinking of more, we want to be the manufacturing partner where we're working with these larger companies to manufacture the cell therapy that they will later commercialize, and Cellino might be a part of that process. So in order to do our technology justice, it's critical that we work with partners who have experience doing this, and they're leading efforts because, of course, there's a lot to learn because taking stem cell derived therapies through the FDA is a new process that we're just learning about. The FDA is learning about it too. So we want to build on that experience and then also really work with companies where there is an unmet need. So they are in the process of developing the first generations of these cell therapies, and Cellino's technology would enable the second, the third, fourth generation of these technologies. We're talking to both top 20 pharma companies and as well as tremendous biotech companies that right now the trend is are raising hundreds of millions of dollars in their first round of financing. So there's a lot of capital available, a lot of brilliant minds, a lot of visionaries who are trying to disrupt the entire industry for drugs. For our first year of existence, the goal was to build relationships with these bigger companies, trying to understand what limitations are they currently facing in the way they are making these therapies, and they're not using necessarily the most cutting-edge technologies that we have access to, and we have the ability to innovate. So it's been very important for us to find folks on the other side who really believe in the technology and are our internal cheerleaders. So we're very grateful for the support. But it's been, to me, perhaps, maybe it's surprising, but the response has been overwhelmingly positive. So anytime we present the possibilities of the technology and what we're trying to do, we've felt a very strong sense of support, wanting to further the conversation. And things have moved very quickly. I know that partnership timelines can be 18 months. It might still be true for us that it takes us 18 months to close our first deal because the negotiations take longer than expected. But I've been surprised and feel very positive at how quickly these potential partners have gotten to a place where, here, we want to do this with you, here's what we're looking for, and now we're talking about the details. So that's exciting. And the way I want to push this forward is we'd love to work with a few partners, maybe different flavors, maybe a pharma company and a biotech company, so that we want to build a greater understanding of what are the challenges, and I think the challenges are different based on the flavors of companies we would work with, but doing high quality partnerships that are meaningful and actually push real products towards the clinic is the #1 priority for Cellino. And in my journey from going from a scientist to becoming an entrepreneur, that's my biggest takeaway. In order to prove to the world that you have a cutting-edge technology that can really make a dent and move the needle forward in how we do therapies and cure patients, that's what we have to do. We have to push that technology towards a therapeutics application as quickly as possible, instead of getting distracted, which is why our entire focus right now is really proving out this retinal therapy pipeline that we have of different cell types in the retina that would cure different diseases. And we're in active conversations with incredible partners to see if we can do it together in a collaborative way and move the needle forward.